Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Oral hypoglycemic drugs, and in oral hypoglycemic drugs, we're looking at the sum class where there is enhancement of the insulin secretion. So the first type of drug will be the sulfonylureas. Sulfonylureas is it has a K-ATP channel blocker, and there is generation 1 and generation 2. Generation 1 is chloropramide, and the tolbutamide. So these are the two first generation. Looking at second generation, it is the glyburide, glipizide, and glimepiride, and the glicazide. So all these are the generation 2. So what is the mechanism of this sulfonylureas? Sulfonylureas, it increases the insulin secretion. So increase the insulin. So insulin secretion, and this is from the beta islet cells. Next, what will be the adverse effects? Adverse effects is that there is a generation 1 and generation 2. So generation 1 will cause disulfiram-like effects. Then moving on to generation 2. Generation 2 will cause hypoglycemia. That is, it is contraindicated in case of the hepatic as well as in case of renal insufficiency. Next, we look at the meglinetide. Meglinetide or the phenylalanine or analogs. Phenylalanine analogs, it includes the repaglinide, the natiglinide, as well as the metiglinide. So the mechanism is it increases the secretion. Secretion is increased from the beta islet cells. And the adverse effects is that it can cause the hypoglycemia. Next, moving on to the glucagon-like peptide. So glucagon-like peptide is one agonist. So this includes the hexaglutide, liraglutide, the semaglutide, as well as the lixisenatide. So all the mechanism is that it increases the insulin secretion, and it decreases the glucagon, and there is a slow gastric emptying and also satiety. Lastly, we move on to the dipeptidyl peptidase inhibitor. This is what enhances the insulin secretion. So the dipeptidyl peptidase inhibitors. So this includes the sitagliptin, it includes the saxagliptin, the vildagliptin, and the linagliptin and the allogliptin. So mechanism is it increases again the insulin secretion. It is increased, and the prolonged the endogenous GLP-1 action. So next is it causes, it can lead to nasopharyngitis. To learn and grow daily like this, please do subscribe.